Hi, I'm Alexandra. This summer, I interned with the communications team at the Larimer County Department of Health and Environment.
Hi, I'm Maggie, and this summer I interned with the communications team.
Hi, I'm Olivia, and this summer I interned with the environmental health team at the Larimer County Department of Health and Environment.
Hi everyone, my name's Cecilia Smith. My pronouns are she, her, hers, and I had the pleasure of being an intern with the tobacco prevention team here at LCDHE this summer.
I'm currently working on my master's in public health at the Colorado School of Public Health, where I'm focusing on One Health and zoonoses.
I'm a recent graduate from the University of Northern Colorado with a Bachelor of Science in Public Health, and I'm currently pursuing a Master's in Public Health with a Certificate in Community Health Education through the Colorado School of Public Health.
This internship gave me hands-on experience in a wide range of field inspections and public health initiatives. I have learned so much about public health, and it's opened my eyes to all of the vital programs that build the foundation of public and environmental health.
Over the course of the summer, I got to work on a good number of projects, and they were all very exciting. I did my capstone for my Master's of Public Health degree. I was able to complete that here.
My main project was creating a social media campaign about bat safety. I researched local risks like rabies and worked closely with our communications and technology specialists to design posts for Facebook and Instagram. These posts help educate the community on what to do if they find a sick bat and how to protect themselves and their pets. Through this, I learned how to make public health messages both clear and engaging.
One of my main projects was supporting the Safe Driving for Youth campaign. I worked closely with the filmmakers to coordinate production from start to finish, handling logistics like organizing food and paperwork, casting youth actors, and managing them on set. Being part of the process from pre-production through the final filming days gave me a new appreciation for the detailed planning and teamwork required to bring a public health campaign to life.
Over the course of the summer, I participated in inspections at restaurants, public pools, and in air quality to learn about compliance with health and safety regulations. I also participated in on-site wastewater treatment system inspections, learning how to evaluate and maintain proper sanitation in rural areas. Each inspection was an opportunity to learn about risk mitigation and the importance of proactive environmental health practices.
I essentially investigated young adult attitudes about tobacco and their behaviors about the tobacco and nicotine products as well. In addition, I got the opportunity to do a lot of community outreach with a lot of different projects.
I also worked on another project related to zoonoses, designing printed rack cards about tick-borne illnesses. These cards offer quick tips on prevention and were tailored for people spending time outdoors here in Larimer County.
I also worked on revamping a sexual and reproductive health presentation for local high school students. That meant updating the content to be more inclusive, medically accurate, and engaging.
In addition to fieldwork, I assisted with air quality monitoring efforts, gaining a better understanding of how environmental data is collected, analyzed, and communicated to the public. Whether I was in a commercial kitchen, near a pool deck, or out in the field evaluating a septic system, I saw firsthand how public health protection starts at the ground level.
I looked and I did a mixed methods analysis of data that had been collected through a focus group that we had done, as well as a survey that we put out. So it was kind of a qualitative and quantitative mixed methods approach, and I was able to use that data to formulate recommendations for LCDHE, CSU Health Network, and other community organizations that do cessation education as well as prevention education for young adults.
Overall, this internship taught me how to break down complex health topics and share them in ways that are easy to understand and remember.
This internship gave me a deeper appreciation for government work and the people who make it happen. Learning more about youth engagement in our community health improvement plan inspired me to think about my long-term goal, becoming a liaison between public health and education in a school district.
This internship taught me how to communicate technical findings clearly and professionally, both in writing and in conversation with business owners and residents. I also gained insight into how education and enforcement work together to promote healthier communities. It is amazing to see how Larimer County interacts with its residents and business owners.
I'm really grateful for the opportunities that I've had to engage with the local community here in Larimer County and also to work alongside these professionals in public health.